Patients often wonder where their hip or knee replacement is going to be performed. We perform surgery at University of Maryland St. Joseph's Hospital in Towson, and then we have 2 surgery centers where we also perform surgery. So the day of surgery, patients usually arrive around 2 hours prior to surgery. You speak to me, you speak to the anesthesiologist, you speak about what type of anesthesia you're going to have during the surgery and any questions about the hip or knee replacement. When you speak to the anesthesiologist, patients usually speak about spinal anesthetic, and so that's our preferred form of anesthetic. With the spinal anesthetic, patients are asleep during the surgery. They don't need a breathing tube, but they are asleep throughout the entirety of the procedure. Spinals, we found, give the best pain control after surgery, and it also reduces the chances of complications like bleeding, blood clots, and prolonged pain after surgery. So after the surgery, the patients go to the recovery room. They stay in the recovery room for around 2 to 3 hours while the spinal anesthetic wears off. And the nurses get the patients up, they get them moving, make sure that they're safe to go home, and then they start talking with the patient's family and the nurses together about the discharge process. The vast majority of our patients go home the same day as the surgery. And we've been doing this for years. It's very safe to get people home the same day. There's some patients that can't go home the same day, either because of medical conditions that limit their ability to go home with us monitoring them safely, or help at home. And so for those patients, they typically stay in the hospital overnight. There's a small group of patients that do need to go to an inpatient rehab center, and that's something that we can discuss at the visit. So patients often wonder, well, what am I going to be able to do when I go home? Well, you're able to climb stairs, you're able to get in and out of a car, you're able to get in and out of a tub, do basic meal prep. Everything that you normally do, you're just moving a lot slower than normal, and so that you have to take into account. And it is helpful to have someone at home, at least at night, but preferably more than that, for the first week or so after the surgery. So there are a huge number of details that you need to know to get your joint replaced. And at St. Joseph's and at the surgical centers, to help patients with that, we've started a nurse navigator service where each patient is assigned a nurse navigator that helps them through the entire process, both prior to surgery and then after surgery, to make sure that all our I's are dotted and T's are crossed to get you through this safely. Most patients come back at around 6 weeks for a follow-up visit. We used to bring patients back at around 2 weeks for suture and staple removal, but the vast majority of patients nowadays, they get a special glue dressing, and so it's a medical grade super glue impregnated in a polyester tape that closes the surgical incision, and that just comes off in the shower in 3 weeks. And so we no longer need to bring patients back early after the joint replacement. They usually come back for x-rays at about 6 weeks. If there's problems, they come back earlier, but most of the times it's 6 weeks after surgery.